Hello, and welcome to the Sharp Psych. Many of us know about abandonment issues, or even face some problems in relationships, or just simply pushing people away without even knowing, and wondering if we are a part of the problem. In this video, we will talk about abandonment issues and how it affects people and relationships. And finally, some advice on how to deal with it. Make sure you watch this video until the end, because it will provide you with a little peace and clarity on these questions and serve as a light for you in your healing journey. Before we get into it, don't forget to hit the subscribe button and turn on notifications so you don't miss more exciting facts about psychology. Also, check out the links in the descriptions for my best recommendations. But now, let's get into it. First things first, a little definition of this disorder. Abandonment issues refer to feelings of insecurity and fear caused by a lack of emotional connection and support. These issues can stem from childhood experiences, such as being neglected by a parent or put in a situation where the child must cope with a sudden loss. If a child experiences neglect, abuse, or is abandoned by a guardian, they can have a hard time trusting others and may feel that they are constantly being left behind. This feeling can stay with them for a long time, as it is difficult to let go of being unwanted or unloved. Although psychologists agree that the most common cause of such mental disorder is childhood trauma, it can also be formed in adulthood. This disorder can be caused by anything from physical or emotional neglect to abuse or abandonment. It can also come from a traumatic event later in life. An individual can develop abandonment issues in adulthood, and it would be the result of feeling betrayed by a loved one or friend. It can lead to deep-seated feelings of abandonment and isolation. Being socially isolated can lead to a person feeling unwanted and alone, and it can also lead to an individual not able to make meaningful connections with others, or find it difficult to find friends or family members they can rely on. In addition to these causes, some factors create an atmosphere where abandonment issues develop easily. Although these factors vary from person to person, they often include physical, emotional, and environmental influences. Physically, it can be created by a lack of physical closeness and contact with a parent or guardian. The absence of physical contact can generate feelings of loneliness, insecurity, and fear of abandonment. It can also leave an individual feeling emotionally and mentally unprepared for the world, leading to difficulty forming relationships and trust in others. Emotionally, the cause can be the individual's past experiences with relationships. If a person had particularly negative experiences with relationships, it can create feelings of insecurity and distrust in others. Environmentally, it can be caused by a lack of social and emotional support. A lack of a supportive and secure environment can lead to difficulties in forming and trusting relationships. Now, to the main question in our title and the core of this video. What is the impact of abandonment issues on relationships? Unfortunately, abandonment issues can have a dramatic impact, as it creates intense feelings of sadness, shame, and insecurity that can be difficult to overcome. When someone has been abandoned in the past, they may be apprehensive to open up to someone new and trust them, or they may be overly clingy and demanding in their relationship. Another thing that affects any type of relationship, which could be the cause of abandonment issues, is the fear of the unknown, making it hard for someone to take risks or put themselves in new situations. In addition, This fear can prevent the person from forming new relationships, or it can lead to a pattern of unhealthy or toxic relationships. And in worst cases, it can lead to isolation and loneliness, which can be very damaging to mental health. On the other hand, having such issues can also be an opportunity for growth. Learning to trust and open up to someone new can be a healing experience and lead to a more fulfilling relationship. However, it requires real work and effort that starts from admitting the existence of a problem and realizing the signs and symptoms of abandonment issue. Signs and symptoms of a mental disorder refer to the physical and psychological states of an individual that indicate the presence of a psychiatric condition. Signs are the outward expressions of a mental disorder, such as physical changes and unusual behavior. However, symptoms are usually the subjective experiences of a person, such as thoughts, feelings, and emotions. Signs are often more visible and can be detected by others, while symptoms are more internal and can only be known by the person. These signs can be different, and they manifest themselves in a variety of ways. But we can often link them to a lack of trust, insecurity, or fear of rejection. And, as I said, recognizing these signs are essential for addressing them healthily and productively. So, the most common signs include feelings of low self-worth, insecurity, feelings of rejection, difficulty trusting others, abandonment avoidance, straggling forming healthy attachments and relationships, and problem with expressing emotions. People may find themselves unable to give or receive love, feel invisible or unheard, be suspicious of others, or be overly needy in relationships. Individuals with abandonment issues may also struggle with feelings of being unlovable or unworthy, leading to destructive behaviors like self-harm, substance abuse, codependency, and unhealthy relationships. They may become preoccupied with the fear of being abandoned and have difficulty establishing healthy boundaries in relationships. Some of the most common symptoms associated with abandonment issues are feelings of emptiness, loneliness, low self-esteem, and difficulty forming and maintaining relationships. And this means that people who have experienced abandonment often feel like they are missing a vital part of themselves, and that they are unable to fill the void. This can lead to maladaptive coping strategies, such as trying to build relationships quickly or relying heavily on others for emotional support. Additionally, the fear of being abandoned again can make them avoid attachment altogether, leading to feelings of loneliness and isolation. Low self-esteem is also a common symptom. People who have been abandoned often feel like they are unworthy of love or affection, leading them to constantly second-guess themselves. They may also have difficulty believing in their abilities, find it difficult to accept compliments, and have a hard time expressing themselves. Finally, difficulty forming and maintaining relationships is another symptom. People with abandonment issues may avoid emotional intimacy, be unable to trust others, and often push away potential partners. This can lead to a cycle of failed relationships, and further, feelings of loneliness and isolation. So, after hearing all of this, I believe many of you are asking how both parties can deal with this issue in a relationship. And let me tell you that it's never easy, but it is possible. Please remember that abandonment issues can be rooted in various sources, including past relationships or traumas, so it's important to be gentle with yourself and your partner when discussing it. The first step that specialists suggest is to understand the root cause. It's important to learn how your issues affect your current relationship and how you can work to build trust. If you have difficulty understanding why you feel the way you do, it may be helpful to seek professional help. Also, when discussing these problems with your partner, it helps to be open and honest. Let your partner know how their actions have made you feel, and be sure to communicate in a respectful and non-confrontational way. While it is important to address your concerns, keep in mind that people can only make changes if they understand the impact of their words and actions. Another thing that could help you navigate through this difficult time is to focus on the positive aspects of your relationship and take time to rebuild trust with your partner. Spend time together doing activities that make you both happy, and try to create an atmosphere of understanding and support. This will help to reassure your partner that they are trusted and valued. Finally, it is important to remember that the only way to deal effectively with abandonment issues is to be patient and understanding. Everyone deals with their problems differently, and it gets easier when you recognize that it takes time and effort to work through them. With the support of your partner and yourself, it is possible to build a stronger, healthier relationship. If things get complicated and you don't know where to start, the best advice is to seek professional help, as it could be a painful and long-lasting struggle. There are a variety of therapeutic approaches that can be effective, but please remember that they're not to be tried yourself without professional help. So, the first step in treating abandonment issues that a therapist can help you do is to build a supportive and understanding environment. The therapist will provide a safe and non-judgmental space for individuals to talk about their experiences, work through their emotions, and identify strategies for coping. Cognitive behavioral therapy, CBT, can also be a powerful tool for treating this disorder. CBT focuses on restructuring negative thought patterns and improving problem-solving skills. Through this type of therapy, individuals can learn to recognize and challenge their thoughts and beliefs about the past, and focus on developing new, healthier ways of thinking. In some cases, medication may be used to help with the symptoms associated with abandonment issues. These can include medication for depression, anxiety, or other mental health conditions. It is important to remember that medication is not a replacement for therapy. Depending on the individual's needs, additional treatments, such as eye movement desensitization and reprocessing, EMDR, or acceptance and commitment therapy, ACT, may be beneficial. Finally, self-care is an important part of the healing process. Taking the time to practice relaxation techniques, engage in activities that bring joy, and build a supportive social network are all important components of recovery. It is important to remember that abandonment issues don't necessarily need to lead to negative outcomes in relationships. Acknowledging and addressing any underlying issues can lead to a more balanced, healthy relationship. With the right support, someone can find the courage to take risks and share their emotions, leading to deeper connection and understanding. I hope this video was helpful, and it's shed some light for anyone living with abandonment issues. Thank you for watching, and check out my channel for more videos. I'll see you next time. Take care.